This is Michael Simione from SimiTree. I am the director, a director on the financial consulting team at SimiTree. I've been working at SimiTree for 12 years, and one of my areas of expertise and a lot of the work that I do surrounds budgeting. And I wanted to talk to you today about preparing for your 2024 home health budget. We're almost halfway through 2023, and it's time that we start looking at and thinking about what may happen in 2024 and how we can prepare as home health agencies, as home health providers, based on what's happened historically. So if we look back at what happened in 2023 or in 2022, in preparation for 2023, we had the start of value-based purchasing. We had a 4%, approximately 4% behavioral adjustment come through. And as home health agencies, we've seen in this year that our costs are doing nothing but going up. Our cost for our clinicians, especially for our nurses, retention and recruitment bonuses, the cost of care is increased in 2022 and continues to increase in 2023. And if history repeats itself, we can expect, potentially further cuts in 2024. So we as agencies need to look for opportunities for cost management as well as revenue maximization. And so when we're looking at cost management opportunities, it may not be on the clinical side that we can look at things, but it may be on visit utilization rather than, our cost of staffing is going up. How can we manage visit utilization to still produce quality outcomes, but be a reasonable cost for our providers for Medicare, for the episodic, as well as non-Medicare episodic, and our fee-for-service payers? In addition to that, maybe there's opportunities from a medical supply or other resource perspective, or maybe we're high in cost on the administrative side. And so we have to drill down into our agency's data in our budget to find every opportunity we can to manage those costs. In addition to that, with, potential changes that may come in 2024, we also have to identify opportunities for revenue maximization. That's looking at our payer mix. What's our payer mix, not only by revenue, but by patient and by visit? In addition to that, under the Medicare and non-Medicare episodic, if we're being paid under the PDGM reimbursement methodology, is there opportunities for us to improve in coding, in OASIS scoring, to drive changes in functional scores, in comorbidity and primary diagnosis that shows the true acuity of the patients that we're caring for. We want to make sure that how sick our patients are and the type of resources that are required is reflected in our medical documentation, and we do that through accurate OASIS coding and OASIS scoring and coding, and making sure that that information is correct. So, like I said, if history repeats itself and we continue to see the changes we've seen in recent years in home health, we really need to start now thinking about our 2024 budget, being prepared and finding those opportunities to manage costs in specific areas, as well as potentially maximize revenue to make up for the industry's changes. Thank you.